Seniors, don't wait for a blood clot. 3 urgent leg exercises for your. Right now, as you are sitting reading this, blood is moving through the veins in your legs. Or it should be, because here is what most people over 60 do not know, and what I wish someone had told my patients before they ended up in front of me. The simple act of sitting still for long periods, which most of us do far more of as we get older, causes blood to pool in the deep veins of the lower legs. And when blood pools and slows, it can clot. That clot has a name. We call it a deep vein thrombosis, a DVT. And if that clot breaks free and travels to your lungs, it becomes a pulmonary embolism, a PE. And a pulmonary embolism can kill you within minutes. I have seen it happen, more times than I ever wanted to. Hi, I am Dr. James Whitfield. I am an emergency medicine physician, and I have been working in the ER for just over a decade. In that time, I have personally treated more than 40,000 patients. And I can tell you honestly that one of the most heartbreaking things I see is a patient in their 60s or 70s coming in with a clot that was entirely preventable. Not because they had a complex genetic condition, not because they were seriously ill, but because nobody ever told them that their legs, specifically the muscles in their lower legs, are one of the most powerful tools they have for keeping their blood moving safely and keeping them out of an emergency room. Today, I'm going to give you 3 specific exercises targeted at the legs, designed to activate what we call the venous pump, the natural mechanism your body uses to push blood back up toward your heart. I am going to explain exactly how each one works, what the research says, and how to build them into a daily habit that takes less than 10 minutes. At the end, I will give you a simple implementation framework, so this is not just information you watch and forget. Before we start, a quick honest ask. Only about a quarter of the people who watch these videos have actually subscribed to the channel. If detailed, evidence-based content like this is useful to you, please subscribe. I promise to keep making the most practically helpful health videos I possibly can. And if you reach the end of this video and did not learn something new, feel free to unsubscribe. Genuinely. No hard feelings. Right. Let us talk about your legs. Here is the mechanism, and I want you to really understand this because it changes how seriously you will take these exercises. Your heart pumps blood down to your legs easily. Gravity helps, but getting blood back up from your legs to your heart is a completely different challenge. Your veins have small, one-way valves inside them that are supposed to prevent blood from flowing backward, but those valves need help. The help comes from the muscles surrounding the veins, specifically the calf muscles, the soleus, and the gastrocnemius. When those muscles contract, they squeeze the veins, they push the blood upward past those one-way valves, and they keep circulation moving. We literally call this the calf muscle pump, or the peripheral venous pump. It is your body's second heart. Now here is the problem. As we age, 3 things happen simultaneously. Muscle mass in the lower legs decreases, a process called sarcopenia. The valves in the leg veins become less competent, meaning they do not close as tightly. And most people spend more time sedentary, either from retirement, from reduced mobility, or from chronic conditions that make movement more difficult. The pump slows down. Blood pools. Clot risk rises. And the symptoms are often so subtle that people dismiss them entirely. A little achiness, some swelling in the evening, legs that feel a bit heavy. These are not signs of aging. These are signs that the venous pump is struggling. What I really want you to take away from this section is that this is not about fitness. This is not about losing weight or building strength in a cosmetic sense. This is about keeping your blood moving and your veins healthy. And the exercises that do that most effectively are specific, simple, and require no equipment whatsoever. Most of them can be done from a chair. So, exercise number 1, ankle pumps or seated heel raises. This is the single most important exercise on this list, and I want to explain why before I tell you how to do it. The soleus muscle, that is the deep muscle of the calf, sitting underneath the larger gastrocnemius, is sometimes called the soleal pump, or, and I love this description, the skeletal muscle heart. Because its primary job when you are seated or standing is to squeeze the large venous plexus in the calf, which is essentially a network of blood reservoirs, and push that blood upward. The soleus is uniquely important because unlike most muscles, it remains partially active even during low-intensity contractions, which makes it extraordinarily effective at continuous venous return. There was a study published in the journal Physical Therapy looking specifically at the effect of ankle pump exercises in post-surgical patients at high DVT risk. It found that regular ankle pumping significantly increased venous flow velocity in the deep veins of the calf compared to periods of rest. The mechanism is direct and measurable. You contract the calf, the vein gets compressed, blood moves up. Every single contraction is a small act of cardiovascular maintenance. Here is how to do it. Sit upright in a chair with both feet flat on the floor. Then simply lift your heels off the ground while keeping your toes down. Hold for 1 second, lower back down. Then lift your toes off the ground while keeping your heels down. Hold for 1 second and lower back. That alternating motion, heels up, toes up, heels up, toes up, is an ankle pump. Do 30 repetitions of each. That is your one set. Rest for 30 seconds and repeat 3 times. The entire thing takes under 3 minutes. Do this at least twice a day. If you are sitting for long periods, do a set every hour. If you are on a long flight or a car journey, do it every 30 to 45 minutes without fail. That is not optional. That is essential. Exercise number 2, seated leg raises with knee extension. This one targets both the venous pump and something else that is critically important for seniors, the quadriceps, which is the large muscle group at the front of the thigh. I am including this here not just for circulation, but because of what the research tells us about quadriceps strength and overall survival in older adults. And this is the part that genuinely surprises most people. A study published in the American Journal of Medicine that followed over 3,000 adults aged 60 and found that grip strength and lower limb muscle strength were independently associated with all-cause mortality, meaning the weaker your legs, the higher your risk of dying from any cause over the follow-up period. Now, here is where it gets really interesting. The mechanism is not just about falls, although preventing falls is obviously critical. Muscle mass is metabolically active, it regulates blood sugar, it supports immune function, it reduces systemic inflammation. Losing it accelerates almost every chronic disease process. Keeping it slows them down. Your quadriceps are the largest muscle group in your body. They are the ones you can most practically maintain with seated exercise. Here is how you do seated leg raises. Sit upright in a chair with your back not touching the backrest if possible. Straighten one leg fully until it is parallel with the floor. Tighten the quadriceps firmly at the top, hold for 2 to 3 seconds, then slowly lower. Slowly is the key word here. The lowering phase, what we call the eccentric phase, is where a significant amount of the muscle strengthening actually happens. Do not rush it. Lower over 3 to 4 seconds, controlled the whole way down. Do 15 repetitions on each leg. That is 1 set. Complete 3 sets with a 30-second rest between each. The entire exercise takes about 4 minutes. If you find it too easy, you can add a light ankle weight, even a 1 or 2 pound weight. But honestly, for most people, body weight alone is sufficient to start with and to maintain for months. Now, one thing I want to address directly here. I hear from patients all the time that their knees hurt and so they avoid anything involving leg movement. And I understand that completely. But what we know from the research is that in most cases of mild to moderate knee osteoarthritis, which is the wear and tear type of joint degeneration, gentle quadriceps strengthening actually reduces knee pain over time rather than worsening it, because the muscle acts as a shock absorber for the joint. A stronger quad means less load going directly through the cartilage. If you have severe knee pain, speak to your doctor before starting. But for most people, gentle seated leg raises are not just safe. They are genuinely therapeutic for the knee. Exercise number 3, standing calf raises with support. I want to be clear about the with support part immediately because safety comes first with every single recommendation I make on this channel. You will stand behind a sturdy chair, a kitchen counter, or any solid surface that you can hold lightly for balance. This is not about gripping for dear life. It is about having a safety anchor so that the exercise can be done with full confidence. Now, why standing calf raises specifically when we already covered ankle pumps? Because the loading is completely different. When you perform a calf raise in a standing position, you are lifting your entire body weight through the calf and the ankle. That resistance is dramatically higher than a seated ankle pump. And that increased resistance drives two things simultaneously. First, a much more powerful venous pump contraction, pushing significantly more blood volume upward per repetition. Second, genuine mechanical loading of the calf muscles, the ankle tendons, and, importantly, the bones of the lower leg and foot. That mechanical loading stimulates bone density maintenance, which is a separate but equally critical issue for seniors. There was a study published in the journal Osteoporosis International that found regular weight-bearing lower limb exercise produced measurable improvements in bone mineral density in postmenopausal women over a 12-month period. Every single year, we see seniors in the ER following fractures that trace back to bone density that had been quietly declining for a decade. The calf raise is not a glamorous exercise, but done consistently, it is doing multiple jobs at once. Here is the technique. Stand behind your support surface, feet shoulder-width apart, toes pointing straight forward. Rise up onto the balls of both feet as high as you comfortably can. Hold at the top for 2 full seconds. Then lower slowly, again over 3 to 4 seconds, all the way down until your heels are back on the floor. That slow lowering is doing as much work as the upward movement. Do not bounce. Do not rush. 15 repetitions is 1 set, 3 sets total, with a 30-second rest between them. If standing on 2 feet becomes easy over several weeks, you can progress to single-leg calf raises using the same technique, 1 foot at a time. That significantly increases the load and the balance challenge simultaneously. One more thing about this exercise specifically. If you find it genuinely impossible to do a full calf raise initially, maybe due to ankle stiffness or significant balance concerns, start with a partial range of motion. Even rising just a few centimeters and coming back down is activating the venous pump. Start where you are. Consistency over weeks matters far more than perfect form on day 1. Now let me be really honest here. I know what happens to health advice. People watch the video, they feel motivated, they try the exercises for 2 days, and then life intervenes, and 3 weeks later, nothing has changed. I have seen it happen with my own patients 100 times, so I want to give you a framework that actually sticks. Here is how to build this into your daily life. The first step is to attach these exercises to something you already do every single day without thinking about it. Not a separate workout session. Not a reminder on your phone that you will start ignoring after a week. Attach it to an existing behavior. The most natural anchor for most people is morning tea or coffee. While the kettle is boiling, you do your 3 sets of calf raises at the kitchen counter. While you are drinking your first cup, seated, you do your ankle pumps. The leg raises can be done at any point in the morning while you are sitting, maybe while reading or watching the news. That is your morning routine handled in under 10 minutes without rearranging your day at all. The second step is the evening anchor. Every evening, before you sit down after dinner, do 1 more round of standing calf raises. That is it. Morning and evening. 2 anchors. The research on habit formation is very clear that linking a new behavior to an existing one, what behavioral scientists call habit stacking, dramatically increases the likelihood of it becoming permanent. The third step is the travel rule. Anytime you are going to be sitting for longer than 45 minutes continuously, whether that is a car journey, a flight, a long medical appointment, a cinema trip, anywhere, you do ankle pumps for 2 minutes before you sit down and then every 45 minutes while you are seated. This is not optional for seniors. The risk of clot formation during prolonged immobility rises sharply with age, and it rises even more sharply if you have any history of heart disease, varicose veins, or previous clotting events. 2 minutes of ankle pumps is a trivial investment against a risk that I have seen end lives in my ER. Now, what I really want you to take away from this video is not just 3 exercises. It is a shift in how you think about your legs as you get older. Your legs are not just transportation, they are an active part of your cardiovascular system. The muscles in your lower legs are working every single day to pump blood back to your heart. When those muscles weaken and when you sit still for long periods, that pump fails. And when the pump fails, the consequences are not abstract. They are blood clots, pulmonary embolisms, strokes, falls, fractures, and loss of independence. These are the things I see on the other side of years of inactivity, and almost none of my patients who ended up in that situation ever thought it would happen to them. The thing is, the solution is beautifully simple when you think about it. 10 minutes a day, 2 sessions, 3 exercises, no equipment, no gym membership, no complex program. Just consistent, deliberate activation of the muscles that keep your circulation working and your legs strong enough to carry you through your 70s, your 80s, and beyond. You have more control over this than the healthcare system will ever tell you. Use it. If this video was useful to you, please leave a like. It genuinely helps this content reach more seniors who need it. Subscribe if you want more videos like this, and share it with someone you care about who could benefit. I will see you in the next one.